And Matt said, well, I didn't learn about it in my residency. And I only do the things that I learned in my residency. I said, Matt, you're 20 years, maybe, I've been telling the story a long time. You're at least 25 years out of your residency. He says, I wasn't taught to think. I was taught what to do, how to do it, and when to do it. And this is an issue. Doctors today are not taught critical thinking. They're not taught how to read an article and know whether it's phony or not. So that does leave doctors largely dependent on their professional societies or on the representatives of companies that come by with information called pharmaceutical reps or other representatives. And it is amazing to me that we do last what we should do first in most of these, and thank you very much for showing that. Indeed, as you see on the left side of the slide, the immune system, allergic reactions, now they only happen if you lose the innate tolerance, which is what you want to keep. But if you lose that, you can have acute allergies. They're always IgE mediated. This is Ishizaka reagent antigen. The left side is what causes hives, wheezes, itching, and anaphylactic shock. So if the bee stings you and you fall down with low blood pressure in shock, I say, ladies and gentlemen of the jury, the bee was responsible. But look at the other side, the delayed side. T-cell reactions, antibody reactions, immune complex reactions, chemical hours to weeks. It can be 2 hours to 2 weeks from the time you get exposed to a food or chemical until a delayed reaction happens. And I don't care if you are the best recorder of what you eat and what you do and what you think. If the thing that provokes your discomfort, your pain and suffering, happened 2 weeks ago, how are you going to figure it out? So many things happen in between. So the reason I chose this area, and before I developed this test, I had developed a half a dozen other tests, including the occult blood screening test for colon cancer that's not interfered with by vitamin C, and we did kidney function testing in case people had allergies to IVP dye that was a bit better as a methodology. I developed a dose-response platelet aggregation. This is measuring an aspect of blood clotting and predisposition to heart disease. It's also called platelet aggravation by people who do the studies. Fibrinogen survival to blood clotting protein. We were the first people in the world to use clottable fibrinogen to measure the survival of fibrinogen. Now, if you measure the survival of a particle that has no function, don't tell me, because you're going to confuse me. But if you're going to measure something, use something functional. At least that's what we thought. So I had a background as a methodologist. I decided to do something so that my kids could eat and have shoes. And the area that appealed to me was this autoimmune, delayed hypersensitivity area, very controversial, remains controversial today. But if we could open the black box of the body's immune defense and repair system, if we could get the immune system to talk to us and say, I'm okay with all of these foods and chemicals, I'm tolerant to all of these foods and chemicals, but there's a small group over here. I don't like them, they don't like me. And if you could comprehensively identify what for each individual were the acquired, these are not genetic, these are epigenetic, these are acquired, what the acquired hypersensitivities are, and then develop a treatment plan where you substitute for the reactive substances and stimulate repair. If you just substitute, you'll make new problems. But the repair deficit that accumulated before you got the test done also needs to be addressed. So it's a program to stimulate, repair, and press the reset button on the immune defense and repair system. First you identify what you react to, then you eat a diet that promotes health, then you think good thoughts, and you move your body around, and most of the time you go into remission. Now we don't talk about cure because these are incurable, but 50 or 80 years of remission, and then we'll talk about cure. Is that okay? Okay. I'm trying to think what else to give you a flavor, because I really want this to be more a dialogue and a conversation than a monologue. Although, if you press me, I'll do a little Jackie Mason. My mom was a jazz musician and my dad was a basketball player, so I come by this honestly. We decided to develop this test knowing that after you made the method, you would then have to go out and do thousands of cases and do outcome studies because other people didn't know this before. We're the first people to be able to talk to lymphocytes in what's called an ex vivo way. Ex vivo means in the laboratory you measure exactly the way it happens in the body. Most lab tests are in vitro because that's the best we can do. They're test tube tests. In vitro means test tube tests. Most tests are test tube tests. A few tests are functional. A few tests measure things just as they happen in the body. And that's the way our LRA by ELISA ACT is done. It does measure all of these delayed pathways, the ones on the right of this slide. It does deal with inflammation, the pain and suffering of inflammation. I hope you've seen those commercials. I don't do those commercials, but some people do. So we want to identify the foods that are burdening the immune system that predispose to autoimmune diseases, to chronic infectious diseases. Remember I said if you were healthy, you were tolerant, and your immune system neutralized anything that came in. Now, how many of these first responders do you have? 50 billion. It's a rhetorical question. 50 billion. And each one of them can engulf 50 foreign particles, 50 bacteria, 50 viruses. So that's 2.5 trillion foreign things can get ingested by a healthy person and recycled without any harm every day. Really? Yes. And if you brush your teeth, it's fortunate this happens because if you do brush your teeth, and I mean with a brush, not with your finger, but if you use a brush, you will probably have 200,000, maybe 500,000 bacteria get into your body, your bloodstream. And fortunately, you have these first responder cells who are just, this is lunch for them. They love this. They go, they soak it up, they put it into a little recycling center in the cell, and out comes good things when you're healthy. But what if what you ate has now choked up the first responder cells and the backup system is backed up? You know, like, think of Japan, okay? The backup systems fail. What happens? Well, now you're hospitable to what goes around. Do you have any friends who are, they catch whatever goes around? Well, you actually have to work to do that because your immune system has 10-fold reserve when you're young and immortal. Now, I see some of you in the audience are probably in the young and immortal category. My children still are. When we have enough of the basics, we are tolerant, resilient, and we repair ourselves. We don't have chronic infections, and we're not even hospitable or susceptible to them. But when we run down, whatever you lack controls the whole system. This is Baron von Liebig in 1842, and we updated it about 1990. So any nutrient, anything your body can't make on its own, anything that's essential, can control the whole metabolism. And I didn't bring it with me, but my colleague Bruce Ames and I have a slide, and on the slide are all the metabolic pathways, and most of them are cycles and circles, and you see arrows coming and going. No mortal human being knows all that stuff. I'm sure there are exceptions, but I don't know who they are. But that's the area that I enjoy being in, biochemistry. I enjoy making it practical. I enjoy talking about it in ways that people can understand. I believe when you know your subject, you can make it understandable. It doesn't have to be full of jargon or complexity. So I come back to where I started, which is you want to eat foods that you can digest, break down. You can assimilate the fuel of your body, and then eliminate. Now, a healthy transit time, and I'm going to tell you how to measure this if you want, and this you can do at home. A healthy transit time is the time from consumption to elimination, from the time you eat the food until you poop the food. And there are many ways of doing this. You can do it with beets, and I'll tell you why I don't. You guessed it. Or you can do it with charcoal capsules, which is what I recommend. So you take a dozen charcoal capsules, and you mark the time. And then you wait until black crumbly stuff that looks like charcoal comes out your tush. Now, that is different than what normally comes out of your tush. And if